community webinar for this research project that is funded by the Population Health Initiative. We are just getting started, allowing folks to continue to join, so look forward to having you enter who you are, and be sure to mute yourself if you have not had the opportunity to do so. As you know, we are recording this webinar.
All right, it looks like that the number of participants has plateaued off, so I think we can get going.
Yeah.
Great. So welcome everyone. We're really happy to welcome you to this third webinar, community webinar, and look forward to responding to your questions, which you can also enter in the chat function as they occur to you, along with currently entering your name and where you're from and any other information that you want us to know about you, that you want this group to know about you. So we will move shortly into our presentation. We will be talking about what we've learned from this year of research, and also talking about next steps as well. So take it away, Gio.
Great, thank you, Anne. Hey everyone, thanks so much for joining us this afternoon. Like Anne said, my name is Gio Jacuzzi. You might remember me from previous webinars. I, along with my great colleagues on this team here, have been conducting some of the noise analyses and calculations of the public health impacts of Growler and other aircraft noise in the region. And today, kind of before we dive into these latest findings that we have to share, I wanted to revisit the kind of primary project objectives that we set out to address with this research. So number one, quantifying community exposure to noise pollution from Growler aircraft activities, right? This is at the heart of what we're looking into. But once we understand that exposure, the important next step is understanding how do we evaluate the potential human health and well-being implications of that for people that are affected. And ultimately, this is this goal is moving towards helping communities understand what are the impacts and how can we help provide context on the situation to inform policy and potential mitigation options to protect public health moving forward. So I'd like to take a moment to kind of remind us of how we've gotten here, and what you can see kind of in this this illustration here is just an overview generally of the different stages of this research project, right? During webinars 1 and 2, we were focused primarily on addressing these two fundamental questions. The first one was, how can we go about measuring the noise exposure of this military aircraft activity in Washington? And how can we quantify it with meaningful noise metrics? The second question was, after we've done that, how can we, what did the results of these metrics that we found suggest about human health and well-being for the people that are exposed to this noise? So we started with a large archive of acoustic data, right? I'll quickly remind us of this kind of a baseline. We looked at around 11 years of combined monitoring efforts by different organizations, government, citizen, industry, including the Navy, the National Park Service, Citizens of EV's Reserve, and Sound Defense Alliance, as well as a few others. And we looked into about 50 sampling sites and analyzed thousands of hours of recorded data that included sound pressure level monitorings and audio data as well. And these initial analyses produced acoustic metrics that kind of characterized the level and the frequency of aircraft noise events in the region across these monitoring sites. So the figure that you see on the bottom here is an example of a field carrier landing practice, or FCLP, session. while the figure above is a more zoomed in look at a single noise event. And the line graphs that we see, you might remember these from last time, they show loudness over time, while the more colorful spectrograms below show the intensity of different frequencies over time. And we found that single noise events, peaked as high as 118 decibels with very pronounced low frequency rumble that extends below 20 hertz. And that's kind of where sound is start to be felt as vibrations rather than just heard through your ears. And we found that all sites on Whidbey Island reached these continuous equivalent levels that were greater than 70 dB over 24 hours. And that's an important kind of threshold because this is the point at which it's recognized that noise can pose a risk of hearing impairment over time. And we also found that similarly, their noise levels that we were seeing at these monitoring sites often surpassed official standards set by the Federal Aviation Administration, the EPA, Housing and Urban Development, and also the National Institute for Occupational Safety and Health. So ultimately, you know, from this first look, we were able to kind of empirically see how noise from OLF Coupeville was quite acute, primarily due to FCLP activities, whereas noise from the alt field operations was heard in several different communities in Anacortes, Lopez Island, across the peninsula, and more as well. But in the second webinar, we also shared findings about the frequency of aircraft operations specifically, and kind of how they were correlated with and changed cumulative noise levels over time. And these metrics are important because they are often the ones that are used in health impact assessments abroad. So we found that flight operations, as some of you I'm sure are personally aware of, were prevalent during school and working hours, with about 70% of operations occurring during the day and 20% during the evening, with the remaining 10% during late nighttime hours. And you can see the average operations per hour in the bar graph here on the top. And we saw that average loudness levels increased dramatically on days with substantial flight activity. So active flying days increased LDEN, which is the day, evening, night average level, cumulative, by 8 to 28 dBA across monitoring sites. We didn't see increases as much at Lopez Island and Port Townsend, where those differences were negligible, but we still saw high levels in individual aircraft events, importantly. But similarly, L-night, which is kind of the nighttime average level exclusively, this level increased during activity as well. And we saw differences ranging from about 3 to 29 dB. And if you look at hourly levels as they changed by the hour, which you can see in the line graph on the bottom here, it could increase by up to roughly 35 dB during flight operations compared to ambient levels. So we were starting to see a very clear relationship between flight operations and the noise that's experienced by people at these monitoring sites. And we know that cumulative exposure over long periods of time elevates risks to human health, right? That's why we're here. And the metrics that we were seeing revealed a few key implications on that line that we wanted to look deeper into. The first thing was that the average loudness values that we were seeing measured, they exceeded the ranges for which there were substantial thresholds or exposure response relationships that had been defined for several different health impacts. So that means that noise exposure in the areas that were being monitored was well beyond thresholds that we know can be harmful to public health. The second thing was that this meant that specific impacts of things like high annoyance and sleep disturbance were likely prevalent throughout Whidbey Island and surrounding communities as well. And the final takeaway here was that these metrics indicated that there was actually a substantial risk of effects like hearing impairment for communities on Whidbey that were living in proximity to the airfields. So all of these implications were very important, but we were limited at the end of the second webinar by the fact that our handful of individual monitoring sites gave us only a localized understanding of noise exposure and health impacts. So that brings us to the primary question that we'd like to address with this webinar, which is how can we evaluate health impacts across the entire region, not just the subset of places that we've sampled in person. And the answer, as you might have expected, is by mapping noise exposure at scale for the population entirely. So our two primary objectives I wanted to underline for this final phase of this project specifically were, one, to quantify the population exposure to noise pollution from military aircraft activities, and then two, as before, evaluate the human health and well-being implications of that exposure at scale, and help us better understand what are the impacts across the region and how can we provide that context to inform policy and mitigation to address public health at scale as well. So in order to get full spatial coverage of the region, we used a standard noise simulation tool that's called NoiseMap. And this is what's used by the FAA, the Navy, and the Department of Defense to evaluate and predict the effect or the expanse of noise levels generated by aircraft activities. So what we did is, according to official standards and regulations, we took the official flight operations data from the Navy monitoring periods that were disclosed during the years of 2020 and 2021, and we put those operations into the NoiseMap models. And then we simulated those flights to produce noise exposure contour maps across the entire region for several different key acoustic metrics that we know are relevant to public health that we've looked at in the past. So this map that you see here is an example of a noise exposure map that was produced for the LDN, or day-night average level, also referred to as DNL. You might hear that more frequently in this part of the world. And what we did is we validated the simulations that we conducted by comparing what did they predict, what were their results, and how do we compare them to the measurements that we actually made on the ground at monitoring sites around the region. And we found that the simulation was quite accurate to within about 4 dB. So knowing that we can have faith in the fidelity of this simulation, then we can start to look a little bit deeper at what does this mean at scale across the region. So looking at this map again, you'll see that the noise levels here are separated in 5 dB increments. And the World Health Organization strongly recommends reducing noise aircraft levels below 45 dB LDN, because aircraft noise above this level is associated with adverse health effects. So what we can do is consider that locations within these 45 dB LDN or greater noise contours, which is what you see on the map here, they comprise the spatial extent of noise exposure that's harmful potentially to human health. And the total area of this exposure we found is about 1,223 kilometers squared, or about 472 square miles. And then when we take this noise exposure map and we overlay this with a population density map for the region, we find that the total estimated exposed population in this area is over 72,000 people. So looking at this map here, you'll see in kind of dashed lines, the same noise contours are overlaid over population density. And I know it's a little bit hard to see, but the brighter the color is on the land areas, the more people live within a given 30 square meter area. So you can see kind of bright spots around Coopville and other communities, Anacortes nearby. And what we see immediately is that Island County is by far the most severely impacted, with an estimated exposed population of about 56,000, amounting to approximately 2/3 of the total county population. And a lot of that is the Oak Harbor area, as you can see in the map. But importantly, this exposure extends beyond Island County, right, and into San Juan, Jefferson, and Skagit counties as well. So another thing that I think is interesting is we looked at the numbers, and about 12,000 people in this area at large are exposed to levels that are officially incompatible with FAA and the Department of Housing and Urban Development's regulations for what is suitable for residential land use. So that's an interesting kind of metric bar to keep in mind for reference. So now that we have this map, right, relating noise exposure to population density, that means that we can actually evaluate these key health metrics that we presented in webinar 2 at scale to obtain the estimated health impacts across this entire region. But before we jump into this, I want to make a few points that are important to consider. We mentioned some of these at previous webinars, but they're important to keep in mind. The first thing is that a majority of the tools that we have for evaluating the impact of aircraft noise on human health are based on data from commercial flights. There is a proportionately much smaller amount of research that's been done into the effects of military noise. And because military operations are more severe in their intensity and more sporadic in their nature than commercial or civil flights, we can expect that several of these impact assessments could actually be conservative estimates, right? But that being said, we know that health impacts vary vastly across individuals, right? If what one person finds highly annoying, some other person might not mind as much, and that could be due to cultural or potentially physiological or other differences. So this is all to say that these results are estimates, but they're estimates that are based on the best knowledge and tools that we have available. Now, keeping that in mind, like we said, we know that cumulative exposure over long periods of time leads to health impacts, and annoyance in particular is an indicator of this. You might recall from the last webinar that we used what are called exposure response relationships to kind of relate the quantitative noise levels to the expected health impacts in the region, or in the last case, at the monitoring sites that we were evaluating. So these are mathematical relationships, right, that have been derived from large surveys of communities that live near airfields or communities that live under the flight paths and are exposed to substantial aircraft noise. And the figure that you see here shows 3 different exposure response functions that relate LDEN to the percentage of a population that's predicted to be highly annoyed. So the purple curve at the bottom is a standard that's suggested by the International Organization for Standardization. The black curve in the middle is a guideline that's given by the World Health Organization. And then the blue curve up top that's quite steeper is a relationship specifically for military aircraft noise that's been derived from surveys of communities that live near US airfields in Japan. And the steepness of these curves, as you can see, this reflects how the likelihood of a health impact can change and is different between military and commercial guidelines and standards. So what we wanted to do was look across this range to understand what is the extent of impacts that we could see, what is the range that we could anticipate. So I wanted to take an example and kind of work through it. In the top right corner of this slide, you'll see there's a small box around an area of Oak Harbor near Altfield. And from our population density map earlier, we know that roughly 10 people reside in this area. The box isn't drawn to scale, but for sake of illustration. So from our noise simulation, we know that this area is exposed to approximately 73 dB LDEN. So we can draw a vertical line then at the 73 dB point on this graph. And then according to the standard curve, the purple one, we can see where those lines intersect. And it's expected that noise of this level will highly annoy 49% of people living within this 30 by 30 meter square. So 49% of 10 people is about 5 people highly annoyed. And then we can do the same calculation for the WHO guideline curve, and we find about 6 people are estimated to be highly annoyed. And then for the military curve, it's interesting because we actually don't know how aircraft noise levels this high can affect people. There isn't really data in the literature about it. So the best we can do is estimate that at least 8 people in this case, but potentially more, are highly annoyed by their noise exposure in this population unit. So, you can probably see where we're going with this, but what we can do then is we can do this calculation for every individual population square in our map, and then estimate the annoyance across the entire region. And when we do that, we find that more than 17,700 people, according to the WHO guideline, are expected to be highly annoyed by Navy aircraft noise. And that estimate ranges, right, from about 8,600 people to more than 32,000, depending on the exposure response relationship that you're using. Importantly, about 5,100 people in the area are exposed to levels that are at or beyond the defined range of these relationships. And that's quite unusual and extreme. There's not a lot of examples that we've seen in the scientific literature, like I said, for these kinds of relationships. So we conducted the same analysis for sleep disturbance, instead using L-night, so the nighttime average levels, and we found that approximately 38,000 people were exposed to noise that's associated with adverse effects on sleep. And of these, using an exposure response relationship, roughly 8,400 were estimated to be highly sleep disturbed. And that includes effects ranging from difficulty falling asleep, waking up to noise events, or in general, just sleeping uneasily. And similarly to annoyance, we found that more than 4,800 people were exposed to levels that are at or beyond the range of the sleep disturbance exposure response function from the WHO, which is quite exceptional. Next, we looked into the risk of hearing impairment and cardiovascular effects due to noise exposure. So the ISO, the WHO, the EPA, all of these organizations suggest that hearing impairment can occur from long-term exposure to a continuous equivalent noise levels of about 70 dB over 24-hour periods. So that's what you're seeing in this figure here. And 8,000 people are estimated to be exposed, or were estimated to be exposed to these levels in particular. Now, those WHO guidelines also state that cardiovascular effects are weakly associated to exposure of the same levels. So the same population was subject to an incremental risk in hypertension and ischemic heart disease, which, while it's a small increase in risk, that can be pertinent at the scale of an entire exposed population when you're talking about many people. So the final impact that we looked at was evaluating the effects of noise on childhood learning. There's substantial evidence for a negative effect of aircraft noise exposure on children's reading and oral comprehension, standardized assessment performance, and also long-term and short-term memory. And we found that 13 schools were exposed to levels that presented an increased risk in reduced reading and oral comprehension on Whidbey Island. And that equates to about a 1 to 2 month delay in learning for every 5 dB increase in noise exposure. So in these maps, you can see these 13 schools are represented as red dots, right? And one of the most severely impacted schools was Coupeville Middle and Coupeville High School, which is located, as some of you probably know, near several flight paths and is quite close to OLF Coupeville. And these schools were predicted to experience potentially a 3 to 5 month delay in learning due to noise exposure. So that was a lot of results. We've walked through a lot of things. So I just wanted to take a moment to look at the high level and just summarize the key takeaways here. We found that the total population that's exposed to noise associated with adverse health impacts was estimated to be about 72,200 people. And you can see the breakdown of how many people were exposed to what level of noise in the bar chart to the right. The table to the bottom left breaks down the exposed population for different health impacts that we talked about. So that includes high annoyance, high sleep disturbance, hearing impairment, and cardiovascular effects. And importantly, again, many people were exposed to levels that are beyond thresholds that are set by official regulations, and also the range of these defined exposure response relationships. So if you consider this all together, really what this means is that we're seeing that the human health impacts of aircraft activity in the region are predicted to be quite substantial. With that being said, what can we do with these results, right? Well, the great thing about this framework that we've employed here is that it can be used to assess the health impacts of noise due to past noise regimes, present, current status of flight activity, and also future proposed flight operations. And we can look at those effects region-wide, right? And this means that we now have the tools that we need to inform communities of what their exposure is now and what it could be in the future. And importantly, kind of highlight what are the areas that might need to be prioritized for mitigation. Where do people need to focus on the most intense impact that's being had? And also, importantly, this means that we can use this framework to provide context, right? To help support changes in policy and ways of thinking about this issue that can ultimately protect public health and make sure that we are doing this in a robust and responsible way. So on that note, I just want to thank you so much for listening. I know that we walked through a lot here in this kind of blitzkrieg of results. But at this point, I'd like to actually pass the baton off to Dr. Julian Olden to talk about what all of these findings and with these tools that we have and where the knowledge gaps are, what all this means for future work in this space and how we can better support impacted communities. So Julian, go ahead and take it away.
Great, thanks, Gio. Yeah, as Gio said, this kind of project, we feel, took the important first step of translating really large archives of noise monitoring data into those spatially explicit maps of noise exposure, and then using basically the most robust science that we have based on the scientific literature to estimate or predict the proportion of the population which is at risk of certain kind of impacts. So this is really, these products are really important, but as Gio alluded to earlier, the amount of actually information that we have about studies specific to military aircraft as opposed to commercial flights and what it means for the lived experience or the local communities in the region is actually, we have much less information about that. So we're pleased to announce that the project team, including additional partners, have recently been funded by the Population Health Initiative at University of Washington to take these efforts even further. And this project, which is going to be conducted over the next year and a half, is going to be kind of building on the knowledge that we have right now to develop new collaborations with community partners to answer kind of what we feel is priority research needs regarding the lived experience of individuals that are exposed to different intensities of military aircraft noise. So to go beyond, in addition to the predictions, and talk about how other factors might mitigate or amplify these health impacts that we see across the landscape. And this is, sorry, Gio, and this is kind of done with both regional and national partners. So it includes a number of the same organizations that were involved with the first project, but now includes Quiet Skies, as well as kind of a national level and international lens through a number of different organizations, which I'll touch upon at the end. Thanks, Gio. So this project has three main objectives, which we're going to be pleased to be reporting back to you over the next year or so. The first objective is to leverage data that we, which have been kind of collected over the years, which is documenting kind of noise complaints from local communities and try to analyze that data to have a more kind of in-depth look at what those complaints might mean for potential health implications. So data that's compiled and curated by the community partner Quiet Skies over San Juan County has about 4 years of complaints, many tens of thousands of complaints, data that's been submitted, carefully curated. And we're actually now really excited to be in the position to actually groom through that data and more formally look at the types of complaints that were made so we can better understand the breadth of community health impacts that are occurring at local scales. We're also going to combine that with the U.S. Navy's official complaint line, which is collect data over a 4 or 5 year period in which the citizens of EB's reserve actually obtained, to basically bolster that data set so we can use kind of multiple lines of evidence to better analyze this complaint data. So we think this is going to provide just a lot of power in terms of retrospectively looking back at what potential health implications this noise means. But moving forward, the second objective, which is interestingly labeled number 1 there as well, shows how important it is. They're all very important to us, is to conduct and better understand how the lived experience of this noise in communities across impacted communities. So that is have test communities to understand what this noise means to kind of everyday well-being. So this is going to involve some kind of classic questionnaire or community survey instruments in which we're going to be working with a number of different test communities and asking residents basically about their lived experience, the types of impacts in which they experience, when they experience it, and then what some of these other kind of mitigating factors kind of come into play in which when it does influence their health. So we're really interested in looking at that, and that's going to span multiple counties, which are embedded across a gradient of levels of noise, which Gio referenced earlier in this presentation. This is really important because research is really aware that individual attitudes and their situation or the context is really important in terms of how they respond to noise. So although these models might be predictive of the percent impacted community, really this doesn't tell you how that is kind of filtered through individuals' attitudes and the context in which they're experiencing that noise. So we're really excited to be working with all of our community partners to be conducting that. And then finally, as we scale down to the local community, we want to scale back up and really use what we've learned here over the past year and the next year as a test bed of informing how other communities can assess similar impacts when they're also exposed to the noise of military aircraft. Gio really touched on this earlier. There's really a dearth of information with respect to what these impacts are. And I think we can view ourselves as basically a leader to try to understand what those impacts are so we can guide assessments for other communities around the country or even internationally. All right, Gio. So how this is going to unfold is going to be over the next year or so period. This project is launching as of a couple weeks, in which we're going to basically be transitioning through each of those 3 objectives, which I've talked about earlier. So from left to right, that's going to be retrospectively looking at the noise complaint data, developing and then implementing these community surveys. So you're going to be hearing a lot from us, and then developing and sharing this assessment framework with our regional and national partners. And we're really looking forward to working with local communities to implement this work moving forward, particularly in the way in which we design and distribute the survey. Thanks, Gio. So overall, what this project is doing is trying to fill some of the local context gaps of the regional-based survey analysis that we just reported on. This idea of, and we're going to be reporting back through regular project webinars, such as the one that you're seeing here today, and also reporting through our community partners, the results that we find. I think really excitingly is that we're going to be working with our network of national and international partners, again, trying to be a leader in the way in which we try to tackle these questions and advancing the science and the understanding of the health outcomes of military noise. And then ultimately, we really hope that this is going to kind of broaden the impact and that our research is having on other similarly affected areas. So with that, I just, on behalf of the entire kind of research and community outreach team, I just want to thank you. All of us are on the call right here. We're going to look through the chat for particular questions that have been asked, but what we're going to do is, and I believe Chris or Anne will be moderating this as we open up the floor to take your questions. So thank you so much.
Thank you, Julian and Gio. So diving into questions, there have been several that have been entered into the chat that folks like Lauren and Edmund have responded to. Most recently, there was a question related to Dean Krath's question about extending the study to address the 2 military operations areas in north central Washington state, acknowledging that the annoyance level is increasing rapidly. So Lauren did respond to that and just acknowledge that we don't have plans to do that right now, but it is really important to have that on the radar of this research team.
Yeah, and I'll maybe speak to that also on a technical level, and because that's a really, really great question and point. It's interesting because one of the limitations that we have when looking at the scale that we just looked at with this webinar of using simulations to understand noise exposure across the region is the activities and operations in the Island County area. These are predefined flight tracks. As you know, a lot of them are regular training routines or interfacility operations where it's very straightforward in a way to anticipate if that flight track is flown by this kind of plane at this time, it's going to produce this amount of noise exposure, spatially speaking. But with the military operations areas, obviously those air-to-air combat simulations are much more sporadic in nature. So there's actually not as fine-grained mechanisms to simulate that kind of activity so that we can develop the same kind of spatiotemporal exposure maps and analyses. So that's kind of a limiting factor there, but there's certainly plenty of work to be done there because it's a really important area. So thank you for raising that note.
Thanks, Gio. And just also acknowledging the questions that were raised about the eastern and western loops out of the outlying field, and recognizing that the example that was used was just one of those, but both of them were included in terms of data analysis. And also low frequency noise. Dean raised that question as well about that Lauren actually responded to. So I encourage people to go back through the chat in terms of some of the questions that have been raised and responded to, and also encourage folks to use this chat function to continue to add your questions. And it does look like this most recent one, thank you, Dean, is: can smartphone noise apps be used to gather useful noise data? Who would like to respond to that one in terms of the phone apps?
I can say some things about phone apps. So the NIOSH has put out a noise app. It was primarily developed for occupational health studies, but NIOSH has done some validations of their noise measurements. But there are quite a few different noise apps that are out there that some do the A weighting, and I think some do alternative weightings as well, which might be useful for capturing some of that low frequency noise that was also commented on in the chat.
Thanks, Edmund.
And I can put a link to that NIOSH app website in the chat box.
Thanks, Edmund.
And
Jane,
can I?
Yeah, go ahead, Lauren. Yeah.
And just briefly on the noise apps. So 2 points about noise apps, just exactly what Edmund said. One thing that I've found is that in doing this work over many years is that the collection of data is not often the bottleneck. What is more the bottleneck is doing something, collection and analysis that results in a meaningful result. That said, noise apps can be accurately used. But I think another point is that the Tier 3 study that Julian described, one of the things that we're doing is creating what we call a noise assessment framework. and sort of a development of best practices for communities, because this is not the only community that is impacted not only by military noise, but there are other noise sources, and other communities struggle with all of these same questions. How do we measure this? How do we classify it? How do we analyze it in ways that are meaningful? So as part of that tier 3 study, we will start to touch on, ways that communities can measure noise and do something with those noise measurements in a meaningful way, including the possibility of using noise apps, such as the NIOSH one is a really great one.
Thank you, Lauren. And Jamie just added a comment. Thank you, Jamie, for being here from Quiet Communities. So you raised the question about, again, underscoring the low frequency noise issue, that it travels over long distances and readily penetrates walls and windows. Closing doors and windows does little to mitigate and creates a feeling of powerlessness and feeling trapped in one's home. Thank you, Jamie, for that important comment about the impact of low frequency noise, as well as your comment earlier about that it'd be wonderful to look at sleep disturbance as a first line response, just like annoyance, and map that to downstream health effects. Does anybody want to comment on that suggestion?
So Anne, if I could, I'll comment on my own comment. The stress response is mitigated by these first line responses like annoyance, cognitive response, emotional distress, interruption of activity, sleep disturbance, kind of all of these. And, it's concerning that the focus just on annoyance, translating that, may not capture these other things that people are feeling. They may not describe them or translate them to annoyance. And so chances are that you're getting an underestimation, of impacts downstream. So that's the point I wanted to make.
Thanks, Jamie. Responses from anyone involved in the research?
Yeah. Go ahead.
No, go ahead, Joe. That's fine.
Yeah, I just wanted to say, no, it's a really, really great point. I think one of the things that as we get deeper into the research, that we started to realize was such a barrier in this line of inquiry is that, like we've said, there's for some of these really important relationships, there haven't been community surveys and studies that have been done that can quantify a link from these exposures directly to some of the health impacts that you're mentioning that can manifest downstream as well. So I think it's good to bear in mind that you're absolutely correct in that we anticipate that a lot of these estimations could be lower bounds because they're using relationships that are not necessarily defined for the low frequency energy that's associated with military aircraft noise, the different kind of sporadic nature of things. But I think an important thing from using this information and this better understanding as a baseline moving forward is that we can see, even using tools and relationships that we know may be underestimating effects, the results that they're reporting are substantial. And so if that's the case, it's clear that there are public health impacts that we really need to, obviously, as people have experienced, we really need to lend additional support in helping mitigate. So Julian, I don't know if you had anything you wanted to add to that as well.
No. I think you nailed it. And I think it's that challenge. And I think the new project might try to get at that a little bit, right? Where we can actually start to better understand them, where we lack the larger kind of predictive data that we can kind of do these large scale mapping. It's this fine line, Jamie, as you know, right, between these big scale synoptic looks at things and then honing down. And we hope we've done it in the right order here. And that's why we're really excited about the next year ahead of us.
Yeah, no, thank you for that. And the work's really wonderful. I think just mentioning it, maybe as you publish some of these findings in the peer review literature, making a point of pulling up these other things and the fact that, it would be great to connect it, but of course it requires the kinds of studies that, we now have for annoyance and the guideline curves and so forth.
Thanks, Jamie.
Sure.
Just maybe add a little bit to Jamie's comment as well. Is, I was reading a recent paper that talked about, the genesis of noise annoyance curves, and the things that we've been looking at with Geo's analysis. And to your point, Jamie, they're meant to be sort of a capture all of many different things, and they were developed maybe at least 50 years ago. The original Schultz curves are what they called. But what they mentioned was that it was actually a need to kind of relate complaint data to something that could be standardized across, and originally those Schultz curves, the annoyance curves, were made around military bases. And so it's kind of, we're reinventing the wheel, the science of the 50s, the 1950s, in terms of looking at complaints, relating it to annoyance. But there's so much more that we could do these days in terms of just talking about annoyance as a capture-all indicator, to look at very specific things that really have to do with wellness and productivity and disturbed well-being. And so hopefully, we'll be able to use some of the new survey results to really dig into those more specific types of things that that bother people about the noise. I can put a link to that paper in the chat box if you're curious about the history of the Schultz curve.
Yeah, the other thing, Ed, that I know about the Schultz curve is that it wasn't specific to aviation noise, if I'm not mistaken. And so, again, it might be an underestimation on that end, given that there's other reports that say that aircraft noise, not military specifically, but is more annoying than other sources of transportation noise.
Thanks, Jamie. So jumping down to John's comment about his experience that the FCLP flights at the outlying field just south of Coupeville regularly deviate beyond the Navy's published flight tracks, and this limitation in the inputs to the simulation should need to be considered when looking at the results. Who would like to respond to that?
Yeah, I can talk to that. That's a really good point, because actually some of those deviations that we saw when we were validating the simulation models against the real world measurements, some of those differences were due to planes flying slightly off of their official flight trajectories. And I think the thing to bear in mind, I think that's a really, really important point when considering the kind of localized effect of noise exposure in a given period of time, or maybe for a given day or a given session. But the area where the simulations really shine, and I think the purpose for which they were made, is they operate off of operations values at a yearly scale. So these are really long-term effects that we're looking at. So if you average out, you could think this flight track specifically has flown this many times, it's probably going to most resemble the official track that's set. And I think it raises another important point to keep in mind, which is that these large kind of comprehensive health impacts that we've talked about and analyzed, like annoyance, like general sleep disturbance, are defined, and the surveys that they're derived from were defined over long periods of time, often annually. So it's more of kind of an average cumulative effect. But it's certainly a really good point that even a slight deviation from a flight track can significantly alter the local noise exposure in an area from what you would expect.
Yeah, and just to add to that, because I think it's a great comment, is that also the flexibility in the kind of the modeling framework that we've created is not only to look at what, future aircraft activity might look like, but also what is the effect of that deviation in particular communities in terms of health impacts, right? So how faithful is it important to be to a path as opposed to deviating from it? So that's definitely something that would be interesting to look at. So it's a great comment.
Yeah, great point, Julian.
Mhm. Thank you. So we have a few more minutes, and I just want to acknowledge the discussion in the chat about the NIOSH app and the extent to which, again, it is reflective of the low frequencies. This is Dean's comment and Lauren's response about, and Dean acknowledges that the LC peak output in the NIOSH app most accurately captures the annoyance level of the deep rumble in my bedroom and kitchen of the jets. And Lauren talks about that this app has undergone the most validation, and she, I think, includes the validation studies, a link to those validation studies. So other comments? Oh, Edmund also talked about in response to Dean around the A-weighting discounting of the low frequency noise. So other comments, other areas of discussion that we haven't gotten to in regards to this work and where we're headed.
And if I'm allowed to introduce a new topic, I have a comment on our presentation, which is stimulated by this discussion in the chat. And it's actually a question to Geo, which is that one of the things, so average noise and low frequency noise are characteristics that I hear a lot of folks talk about. I also hear folks talk a lot about the maximum noise levels, those really intensive. And so someone just made a point about flights deviating in altitude. So then they fly really low, and that noise level is obviously far more than one would expect. And so I'm curious, I'm thinking about this intersection of modeling the maximum, like the typical maximum that someone might expect, because then that gives you a way, then if you actually measure the noise and you're like, okay, wow, that was even beyond what a maximum might be, it can give someone a frame of reference around, was that way out of line? And so I don't know, but the maximum event, the maximum noise level often seems, along with the low frequency, I hear a lot of people talk about that issue. So
yeah, no, that's a really, really great point. And I think something that I've looked at, I've begun to look at is these noise map simulation models. I'd have to look back at my notes whether they directly can produce estimates of maximum levels across the region for different operations, but they are able to simulate SEL or if you're in European countries, LE, which is kind of a quantitative, a way of quantifying the total exposure of a single event. And it takes into account, right? Some of y'all might be familiar with this, but it takes into account the duration of the event as well. And that's something that's very closely related to these other kind of extrema when we look at analyzing the effect of an individual noise event. So that's something that we've seen also in the past. There actually used to be a protocol in the ISO standards that was the kind of best way of estimating the probability of awakening, if I'm remembering right, was originally done with individual event SEL, but that was redacted in the early 2000s because it wasn't seemed to apply reliably across different kinds of noise around the world, and it wasn't deemed to be reliable enough for an official international standard. But that being said, those kinds of relationships still exist for certain kinds of noise. So it's a really good idea. It's something that we can dig deeper into.
Thank you, Lauren, for raising that, because that's a really critical aspect of the experience of people who are impacted. So we have just another minute or two. We'll see if there's any other questions that emerge. And I just want to acknowledge on behalf of the Sound Defense Alliance that we have been really honored to be a part of this research. And I know that's true for every other partner in terms, I know, for citizens of EB's Reserve. And now moving into Tier 3, there are a number of new additional, I shouldn't say new, but additional community partners who will be involved in this research. And it's a really exciting team with which to be connected. I also want to announce that the Sound Defense Alliance is celebrating our 5th anniversary next Wednesday, the 30th of August at the Nordic Hall just south of Coupeville. It is an in-person event, and we encourage folks to come and celebrate with us next Wednesday from 4:30 to 7:30 at the Nordic Hall for folks who are in the region. And then there's another, Diana McLeod. Is there a plan for these results to be shared with any of the powers that be? Or is that for a future conversation? Thanks, Diana. Who would like to respond? I can certainly respond on behalf of the Sound Defense Alliance that yes, we are continuing to work with our elected officials and do plan to set up an opportunity to share these results with our members as well as potentially staff members of the offices, particularly of our federal elected officials. And we are in the process of being able to work with generating a summary that will be useful to those folks. So thanks, Diana, for that that question. Any other comments about that in terms of sharing the information? I think, let's see. Thanks, Tara, for adding the link for the celebration details. And Lauren, thank you, the one-page highlights document to share. And publishing, yes. And thank you, Michael, for your feedback that this has been extremely informative and impressive. Any other final comments?
Right on time, Ann. Look at that, 2 o'clock.
That right on the button.
Well done.
Thank you, everyone, for joining us, and we look forward to having you work with us and participate in our webinars for the Tier 3 research that's right around the corner. Actually, not around the corner.